Ankylosing spondylitis. Reverse stiffness naturally. Proven effective Ayurvedic Ayushakti treatments, diet, lifestyle changes. Does your spine feel stiff like an iron rod every morning? Simple movements like bending, turning, even walking starts feeling difficult, painful, restrictive. In ankylosing spondylitis, it can feel like your body is slowly locking itself into a bamboo tight straight spine, and your HLB27 is strongly positive. In our files, over last 38 years, in our files, we have treated hundreds of cases, and many of them went in total remissions for more than 10 to 15 years. I am Dr. Smita Naram, co-founder of Ayushakti, and I will share today from our record and experience, proven diet, lifestyle changes, home remedies, etc., which can help and give relief in ankylosing spondylitis. The symptoms normally are chronic, persistent, deep back, buttock and hip pain. The chronic morning stiffness, which reduces when you move. The fatigue keeps building. HLB27 strongly positive in the blood test. And that confirms that you have ankylosing spondylitis. Loss of spine flexibility leading to straight bamboo spine, like a bamboo which is straight, and if you bend it, it breaks. That kind of spine becomes. All the vertebrae fuse slowly and steadily, and cartilages become hard, and you turn into question mark posture, a stooped posture. You turn into question mark posture, a stooped posture where upper back bends forward, reduced chest expansion, so difficulty in taking deep breath, you have shallow breath and the oxygen reduces, makes you feel fatigue all the time. Over time, the spine could start fusing, while painkillers help manage pain, but then you feel dependent, tired, suffer from side effects, and uncertain about the future as painkillers can't stop degeneration. From a modern perspective, ankylosing spondylitis is a chronic autoimmune inflammatory condition. Chronic inflammation will trigger, because there is inflammation in the spine, body's response to prevent and protect the vertebra from inflammation is that it will create a new bone formation around the cartilages, which finally make that spine fuse and become like a wood. You can't move anyways, like this, forward, backward, all this sideways, you can't move. It becomes very stiff. The immune system attacks spinal bones and joints. It can impact the shoulders, knees and ankles even at a later stage. In Ayurveda, this condition is understood as Gambhir Asthi Majjagat Vata Vyadhi. Key factors include Vata, the air imbalance in the spine. So air goes into the spine and air is dry, so it causes dryness, stiffness, degeneration and bone overgrowth. The ama toxins, which are accumulated because of the poor digestion and Pachak Agni, that mucus gets deposited in the spine, causing blockages and inflammation. The ojas get disturbed. The immune system, by mistake, thinks that these toxins are viruses or a foreign body, and it creates antibody to attack our own spine. This leads to pain, stiffness, restricted movement, progressive degeneration. These antibodies are the one which you get it in the blood work. HLB27 is that actually the genetic factor or the factor which is triggering the antibody. When that goes down and becomes negative, your disease can go into remission. At Ayushakti, we don't just manage symptoms, we work on detoxification, pulling out the toxins and restoring and strengthening the system completely so that it can go in remission. Step 1. Detox and remove blockages. The first focus is to clear toxins. Pull out the inflammation and toxins from the spine. Arthrox detox program includes Virechan. Virechan is a purgation therapy which deeply detox and removes mucousy toxins through the stool. Basti, enema. These are medicated enemas done under doctor's guidance, and it pulls out excessive air from the spinal area and lubricates the joint. You remember we spoke about drying and becoming stiff the vertebrae. When the lubrication happens, the flexibility comes. And finally, external spinal oil dhara, we call it kati dhara, which nourishes bones and spine. Of course, this is a very chronic situation, so you have to keep working on it for years and years and years. Mr. Rajesh, who was treated by our Dr. Ketki Trivedi in Mumbai, architect who came with HLA-B 27 positive. In the first stage of Arthrox program with the detox, he reduced stiffness by 80% within 3 months. Flexibility improved significantly. Disease progression actually stopped. And then we went into step 2, restoring and renewing the system. So inflammation was reduced. We rebuilt the system through herbal formulas, diet, and the key formulas include Pain Mukti MJ. It is a herbal compound for reducing inflammation, and Pain Mukti Sandhikail for nourishing the bones. Both of them are proven as per double-blind study to get rid of flexibility, nourishing the bone structures, and creating almost 80% better performance of the joints within 3 months. I have put the link in the description of this particular research paper. You can look at it. Immuno for calming the hyperactive immune system naturally. So this and other combination actually helped him to slowly and steadily calm down the immune responses continuously and built up the strong bones. The diet plays a very crucial role in managing ankylosing spondylitis. Please follow more food to include vata pacifying, anti-inflammatory type of diet. So warm, freshly cooked meals are very important. Moong dal, khichdi, lentils, dal but very hot and properly cooked, light grains, quinoa, jowar, millet, etc. are extremely healing the inflammation. Moong and legumes, well cooked, are important. Vegetables like squashes, particularly like bottle gourd, lauki we call it in Hindi, ridge gourd, turai, padwar, etc. type of vegetables, squashes and pumpkins, etc. Carrot, leafy greens, cooked veggies are important than raw food. Fruits like pomegranate, sweet fruits, apple, amla are helping to balance the immune system very effectively. Avoid every sour food because they will make you stiff. Healthy fats like ghee, olive oil are very important for the cooking. Spices like turmeric, cumin, coriander, fennel, ginger, garlic, use them sparingly in your food and avoid chilies as much as possible. Foods to avoid. Foods which are triggering inflammation should be completely avoided, like cold, refrigerated foods, refined flour, wheat, heavy to digest foods, sour, fermented foods, red meat, processed food, ice cold drinks, excessive caffeine. 1 cup of tea or coffee is fine, maybe maximum 2, but not too much. And in the lifestyle, add every day without fail 10 minutes off, Anulom Vilom, alternate nostril pranayam every morning, because that calms down autoimmune responses very effectively. Regular walking as per capacity. Start with 10 minutes, then 15, 20, and you can do 10-15 minutes walking 3-4 times a day. Don't overdo, but keep moving. Gentle yoga and stretching, especially Trikonasana, Parvatasana, Matsyasana, where you do the sideways stretching, twisting like this. This kind of movements are very good. Avoid excessive strain, too much working, and also forward bending exercises, because that will be very difficult, can damage the spine. Add lightweight training. Lightweight training, 1 kg, 2 kg. If you do it 2-3 times a week, it will slowly and steadily strengthen your bones and stop the progression very effectively. Swimming twice a week helps a lot. Maintain proper sleep routine. Always sleep early, and 8 to 9 hours of sleep will be very important. Avoid cold exposure and late nights. Ayushakti's protocols are completely backed by clinical experience and research-based observation. Significant reduction in dependency on painkillers, up to 95% improvement in stiffness and mobility, and improved joint flexibility and functions. Long-term cases show better structural stability in documented cases. Clients have shown reduced inflammation markers. Sometimes even CRP becomes negative, the inflammatory marker CRP, improved mobility scores, and better quality of life. They can stand for long hours, they can sit and work for long hours. I just want to quickly share a real case again. Anjali Kataria. 15 years ago, she had HLA-B27 positive. Within 7 months, 60% reduction in back pain, 60% reduction in stiffness, and this client continued to improve with ongoing care for 3 years, and finally completely recovered with HLA-B27 negative. It's now complete remission for 12 years. Every year she checks the blood work, HLA-B27 have been negative. This is possible when you follow a specific principles in life, or anti-inflammation and nourishing your bone constantly. Ankylosing spondylitis is not just a spine condition. It affects your movement, your posture, your confidence. If we only treat symptoms, the condition progresses. But when we address the root cause, vata imbalance and toxins, real long-term improvement becomes possible. Don't let your spine become a bamboo prison. Connect with Ayushakti to explore a natural root cause based approach. Namaskar. Stay healthy and stay happy.